My name is Sami Sabiti. I'm Ugandan by birth and a nomad by desire. But of all the places that I go, coming back to Africa is what really makes me happy. I love connecting with people here, listening to their stories. Of course, the story that I often listen to is about HIV Aids, TB and malaria and the impact that these diseases are having on our people. It's often a very devastating and cruel story, but it's also one that's full of hope. And so I'm setting out on a journey to uncover these stories, to listen to them and find the people that are committed to making a real difference.
My journey is taking me from the south to the north of the continent, crisscrossing 4,900 kilometers, 3 countries and many cultures. It starts in the Kingdom of Swaziland, a small country with a population of about 1 million. It is well known for its beautiful scenery and friendly people, and also for the fact that it has the highest HIV rate in the world. It is estimated that 42% of mothers tested at antenatal clinics are HIV positive.
So the infection rate among the general population is around 19%. That means, looking around me here, 1 in 5 people have HIV.
I'm on my way to talk to Nicholas Demey from the Global Fund. This is one of the largest funding agencies in the world dedicated to fighting AIDS, tuberculosis and malaria. In January 2009, the Global Fund entered into an agreement with Standard Bank, the largest bank in Africa, to provide financial and management expertise where needed. I want to find out more.
The Global Fund is a financing institution that was created in 2002 with strong backing from the G8 and then UN Secretary General Kofi Annan. Basically, Kofi Annan called for a war chest back then in 2001 to fight against 3 diseases.
How successful have you been up to this point?
At this point, we have invested $16 billion in 140 countries, and the results are there. 3.5 million lives have been saved approximately.
How do you differ from other organizations out there?
Basically, the organization is built on 3 pillars. One is transparency, so basically all decisions that are being made available on our website.
Right.
Another thing is country ownership. It's the countries themselves that are doing the work. Another thing is performance-based funding, and that is very important to the Global Fund. Funding is basically made available only to projects that are working. After 2 years, we do a complete checkup of the program. And then we can make hard decisions. We can say, the program is not really working, or the money is working and then the program can continue for 3 years. And that is also where our partnership with Standard Bank is making a difference, because some of our recipients have problems with financial management or could use some training and workshops.
Right.
And that's where it enables the countries to focus on their mission, that's saving lives.
Right.
Forming partnerships with private sector companies is a good idea, but in practice, will it really work? Calvin Maseko is from Standard Bank in Swaziland, and he can fill me in on the facts.
It's a pro bono agreement where, as Standard Bank, we are offering certain services to the Global Fund and its principal recipients and sub-recipients with no conditions attached.
Why would a bank and the Global Fund get together in this way?
We are the largest bank in Africa. We've got the footprint, and we are in most countries that Global Fund is trying to target. We want the beneficiaries of these funds to be receiving them in a much quicker and more efficient way. There are certain challenges. There is lack of corporate governance. There is no proper understanding of financial management in terms of producing financial statements, proper records for them on how the funds have been utilized. And from a sub-recipient's point of view, the challenge has been, for instance, how do they apply for these funds? How do they, for instance, write up their reports? And also, how do they make reports as efficient and user-friendly so that they can access the funds much faster?
My journey is taking me a little further away now, from Swaziland to the mountain kingdom of Lesotho, just a few hundred kilometers away.
This is a country of about 1.8 million people, and a large percentage of those still live below the poverty line and in rural areas just like this. HIV AIDS is still a major problem here. In fact, Lesotho has one of the highest infection rates in the world, and that plus issues like poverty, issues like TB, pose a big threat to the future.
The only way I will know how the partnership between the Global Fund and Standard Bank is working is to go to a training session and speak with some of the sub-recipients.
You get the cash and you go directly, you pay your suppliers, and what happens with the change? Back to the bank. Don't mix it with petty cash. And what about the staff loans? No staff loans.
One of the first things I want to know is about the training itself that you're receiving. Tell me a little bit about it.
Where I work, I am the executive director and I'm in control. I'm the principal accountable person. So I need to, I'm responsible for the last cent. So it has been a problem, a challenge to me to actually understand what the report from the accounts is all about. So most of the time I found myself signing things which I didn't even understand.
You have to give good reports. You have to show what you did with the money. You have to give good budgets and everything else. So we had a strong challenge because we didn't have any background insofar as accounting is concerned.
I'd like to know your thoughts about the future, what you'd all like to see collectively 5, 10, 15 years from now.
We would like to see an independent, strong, economically and politically competent nation, and one that I would like to repeat does not have as much HIV and TB as we do now.
Paul Manamalela from Standard Bank has a huge passion for this partnership between the Global Fund and Standard Bank.
This goes with the vision of the bank. We try and make a difference in the communities that we operate in. This is just one of those examples. We looked at our clients in the form of Global Fund recipients. We saw a need to improve the capacity because the monies were not being transferred to the people on time. So we had to find where could we unlock the whole bottleneck. As we were brainstorming, we found that the best that we could do was to work on the financial management training. Most of them were resistant in the beginning, but at the time when we did the first course, which is about 6 months ago, they started appreciating that this is like an eye-opener. Oh, we didn't know this. This is how donors want their money. Is this how donors want us to report? Is this how they want us to account? These people are agents of a mission. A mission is simple: better life for all.
Small and deadly, the female Anopheles mosquito. In Africa, a child dies from the bite of this insect every 30 seconds. Nigeria has the highest malaria burden of any country in Africa, and it is its foremost killer disease. About 225,000 people die every year from malaria, almost all of them children under 5. I'm standing in Abuja, federal capital of Nigeria, where the largest malaria agreement ever was signed by the Global Fund and the Ministry of Health. $285 million will help put bed nets in every home in Nigeria. My first stop today is the National Malaria Control Programme to chat to Dr. Yeni Shafola about the situation in Nigeria.
So malaria in Nigeria is obviously a huge problem, and in some senses bigger than HIV. Given that, what are the kind of things you're doing strategically?
We are aiming to distribute over 62 million nets and also to provide over 100 million doses of the effective artemisinin-based combination therapy. And also we're providing treatment for the preventive treatment for pregnant women. And we're also scaling up our indoor residual spraying in selected areas. We're also piloting larvicidin so that even at the breeding sites, we are able to get rid of the larvae. So this is being piloted for us to be able to scale up all these interventions.
I joined aid worker Nuruddin, who took me deep into rural Kaduna, up in the north of Nigeria, where malaria is endemic and rampant. Nuruddin is with the Society for Family Health, an NGO supported by the Global Fund. They are involved in the prevention and treatment of malaria and target mainly children under 6 and pregnant women.
When they brought her, she is convulsing, seriously convulsing with high temperature. We examine and diagnose he has severe malaria.
Okay. What is the likelihood that you're going to see this child again soon for the same problem?
We used to give them nets. When you have it, you give them nets. After the treatment, they go with it. And that's all.
The Global Fund has committed to supplying 30 million mosquito nets by December 2010. These long-lasting nets are treated with insecticide and are safe and easy to use. In countries that have conducted mass distribution of bed nets containing insecticides, deaths from malaria have dropped dramatically in a short period of time. I can see that malaria is a huge problem here in Kaduna. But what about the cities and affluent areas of Nigeria? I'm off to ask some Standard Bank staff working in Abuja what their experiences are.
There's nobody in Nigeria, born in Nigeria, lived in Nigeria, that had not had malaria before. It is not possible.
I get sick from malaria once a month, and that is not fun at all.
Presently, I have malaria, and it's terrible, man, because temperature, headache, and things like that are things I have to contend with every day while I'm working.
Malaria doesn't discriminate. It doesn't know who is rich and who's poor. The mosquito just lands on anybody and takes them out.
Nigerians will give anything to stop malaria, anything.
Well, I have seen some amazing things on this journey. The Global Fund putting the resources in, Standard Bank helping to build capacity, and of course the people on the ground doing the implementation that are really making the difference. I'm very impressed, and I think we all have a reason to be hopeful about the future.